Hello there, my name is Josie. I'm the speech pathologist who is part of LiveBig. I'm based in Western Sydney and I support participants across the lifespan.
Nice to meet you, Josie. So, in your experience, what's something people are surprised to learn about speech pathology?
I think that the biggest surprise is that speech pathologists don't just work on speech. We're also the professionals who assess and manage swallowing disorders. So we help people eat and drink safely after things like stroke, Parkinson's, dementia, and other neurological conditions, which many people don't actually realize is a huge part of our role. And of course, alongside that, we do support communication in all of its forms. So not just speech. It includes things like language, social communication skills, various voice disorders, as well as alternative and augmentative communication. So high-tech devices that replace verbal speech. So really our role is about helping people communicate effectively, as well as eating and drinking safely across every stage of life.
So, what type of goals do you commonly support participants with?
I find that goals are always individualized and based around what is meaningful and functional to the participant. So communication goals can be anything from speech clarity if someone has a stutter issue, as well as language development, social communication and conversational skills, maybe literacy. So if kids or adults have issues with their written communication skills, we can help there. As well as high-tech devices, so AAC for people who have quite complex communication needs. Swallowing goals can include things like eating and drinking safely, improving swallow function where we can, maintaining nutrition and hydration, as well as just making meal times a lot more enjoyable for the individual. But the most important thing is that the goal needs to be functional and meaningful. So we decide what the overarching goal is. So if the participant would like to order something at a cafe or be able to make phone calls or be able to advocate for themselves, then we structure what we do within sessions around that to fit that goal.
Can you share a success story that has stayed with you?
Yeah, there's so many. One that always sticks out in my mind is I worked with two adolescent brothers who had never previously accessed speech pathology or allied health for that matter. When I met them, they were nonverbal and relied very heavily on body language and behaviors to communicate, which meant that their needs were often quite difficult for their family members and their support system to interpret. So I worked with their families to trial high-tech AAC devices, various different technology, and they picked up the technology incredibly quickly. And over time, they were actually able to use their devices across the different contexts and with lots of different people, giving them much more effective and independent way to communicate. I do find that it was incredibly powerful seeing that happen and seeing the impact that actually had, giving them access to their voice essentially for the first time in their lives. And not just for them, but also for their families and the entire support system.
So, how important is family involvement in therapy?
Family involvement is essential. The best outcomes always happen when everyone is working together. I find therapy is really such a small part of the participant's week, and progress happens through everyday practice, not just with the 1 hour that I might spend with them weekly or sometimes on a fortnightly or even monthly basis. So we work collaboratively with families to develop practical strategies that fit naturally into daily routines, because our goal is always functional and meaningful outcomes. So consistent support across homes, schools, or work, they help to generalize the skills that we learn in therapy. So family involvement helps to actually action the things that we've been practicing within session. And it is most important with, it is very important with children, but also with valuable with adults participants, because by supporting communication and swallowing, it's still a carryover of the strategies that we learn within session. But the most important thing is that every family is different. So it's important to tailor our recommendations to what fits their lifestyle and avoid any unnecessary burdens. Yeah.
So like a complete collaborative approach.
Exactly.
And I guess with more family involvement, you're offering support to them as well, so they're not carrying so much burden.
100%. 100%. Yeah.
I'm going to throw a curveball one.
Okay.
Describe working for LiveBig in 3 words.
Oh, in 3 words. Oh boy. Okay. I would say diverse, meaningful, and fun. It's just fun. Everyone on the team is just so lovely, and it doesn't matter if I'm talking with someone from the admin team or one of the other clinicians that we might be collaborating together on a participant, but everyone's so lovely here.
Oh, that's great. Fun and meaningful. That's important.
And diverse. Every day is different for me. Yeah.
Oh,
no day is the same. Yeah.
It's great. Well, it was lovely meeting you. And thank you for sitting down and having a chat with me.
Thank you, Sarah.